So what does invisible illness disability mean to you? Like personally, what does it mean to you?
It's almost like a secret that you try to hide.
Do you try to hide it, or is it just hidden and you don't tell people about it? Are you embarrassed by it?
Sometimes, but I've been told a lot that pain is subjective, so some people feel pain worse than others, and so, what my severe pain for me...
Could be different for somebody else.
Right.
Is it, this part can be a little bit more broad. Is it more than just pain and fatigue? Are there other invisible disabilities that you've experienced in your life?
Anxiety and depression.
Do you think you've ever experienced PTSD or any learning disabilities?
I've certainly had, I call it PTSD, but...
Never diagnosed.
Right.
So, this is kind of an obvious question, but I'm going to ask it anyway. When were you first symptomatic or diagnosed? Was it in one event, or did it happen over time? What's the progression of your ankle pain? And we can go with your shoulder pain, too. I know that you deal with shoulder pain from when you did dental work as a veterinarian.
2013 was when I broke my ankle.
And you've dealt with it ever since, right? It's still not gone.
No, not gone. And my back has been messed up since I fell when I was 17.
And has anything worked to help with the pain? I know you use gabapentin.
I use gabapentin and Advil.
Do you get any government help
No.
for your disabilities? Would you consider them a disability?
Absolutely.
What about an illness? Would you consider those an illness, more or less? When it gets worse, is it more like an illness?
Kind of, but I kind of see illnesses as, the flu or cancer or...
Sure. For the pain level, is it pretty level now, or do you still have days that are just unbearable, and you have days that are you can barely tell?
Yeah, I definitely have days where I feel pretty good. Pain levels at like 2, but I definitely have days where...
But you can't really voice that to people, right?
Mm-hmm.
So they treat you the same on a day-to-day level.
Right.
That's part of the trouble with invisible illnesses,
right.
Disabilities. Do you have a story, positive or negative, that happened since 2013, since you've hurt your ankle, that you wish to share? Like, what story stands out to you? Whether it's something that a doctor did for you, workers' comp, someone that's taking care of you, getting back into work after being out of work.
Well, workers' comp was ridiculous. They wouldn't help me at all. I never asked for money. I never asked for drugs, and they still wouldn't help me. So I ended up losing about $100,000. Actually, probably over $100,000 in surgeries and doctor visits and all that.
And that still affects you today, right?
Right. Yeah.
But what's like a story? So, do you have a story that you want the small world that we're speaking to know about?
I don't know. Invisible pain is hard. I mean, it makes you feel like you're alone.
Do you think it's contributed to your other invisible disabilities?
Yes.
Anxiety and depression?
Absolutely.
Do you think that for you the worst of it is over, or do you think that the worst is yet to come?
Worst is yet to come. Because,
because
every year it gets worse and worse, and it doesn't subside as quickly.
Do they have like an ankle replacement surgery that you can do?
Not really at this time. They're working on it, but
are you hopeful that at some point they?
I'm hopeful, yeah, but there's a life
expectancy, sure.
Right?
Same with the knee.
Yeah.
10 years, right?
But the problem with ankles is it's a one-time thing. You can't do the replacement and then do another one.
Right. So mostly I just had the time to look at the introduction, which gives you kind of a summary of what the book's going to be about. And some of the things that she talks about, and you can confirm or deny this, is she gets a lot of judgment from using handicap. I don't think you use a handicap sign, do you? Mm-hmm. Yeah, so I mean, But just because it is invisible when you show up to the. I mean, I've driven with people. My dad's disability used to be invisible before he lost his leg. But I mean, you'd get lots of stares, especially like, don't take this the wrong way. I mean, if you were to pull up to a handicap and you got out and you're walking in, right? People aren't going to take that super well. They're going to assume you're just fine.
Yeah.
And she talks about the same thing. I mean, she's a thin, fine-looking person, but she has chronic pain, chronic illness, and people stare at her when she gets out. She'll get comments like, "Oh, so you're sicker than I am. How so?" And blah 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 blah.
Yeah, you get that misconception of like crutches.
Yeah,
like
exactly.
You're supposed to have something.
You're supposed to have
support
something.
yourself.
Yeah,
Yeah, just walk with crutches and it's okay.
Yeah.
Same thing with like irritable bowel syndrome. She talks about how she has to leave 3 or 4 times in a business meeting, and how her clients just don't quite understand that. Why are you 4 times in a short business meeting is
that'd
is
be
a lot.
awkward to like explain.
But she talks about the importance of, and like I said, you can confirm this or not, building a good support system, knowing that nobody's going to 100% understand what you're going through because they can't see it.
Or feel it like they.
An analogy that was used is that if you have a hill and you undercut the bottom of the hill and then you cover it up, the damage is still there. You just can't see it, and there are going to be effects on the physical aspects of the hill. It's going to sink. It's going to collapse in, but you just can't see where the cavern is.
Yeah, that's true. You take the bottom out, and it's all going to come crashing down.
It's all going to come crashing down.
Yeah. I think that it is really important to have a support system. Like, you gotta have people on your side that are like, hey, because it can be really heavy and just kind of weigh on you when you're just like going through your day and like you're like, this is hard, I just want to give up, and then you can call somebody and they're like, hey, you got this, keep going, you can do it, and you're like, okay, just for you.
I was gonna say, your mom calls it just the right time, and
she does every once in a while. She's like, hey, I was thinking about you. I'm like, you need it too.
No, it's interesting that we can kind of almost bring this back to the spectrum of autism. How invisible illnesses have such a variety of characteristics that you can never guess what somebody has. I mean,
no,
I don't know the statistic.
You can look around and like there's probably somebody with an issue right next to you, and you never know.
I was gonna say, I'm sure the statistic is it's a 50-50 shot at least of if somebody has an invisible something, right?
Yeah, and so like for pain, chronic pain is anything over 3 months.
Yeah.
So I mean that can be a temporary thing. That's somebody is having issues after surgery, and there you go. So it's not just these people that are just crippled for life and just gonna deal with this, but it's
Is there
it's a lot of different people.
Is there a separate name for like you have surgery or you're in pain for 4 months, or this is your life? Is there a different word for those, or are they the?
No, they're all. There might be, but
chronic post-surgery or post-surgical pain.
Okay.
Essentially, something that's like caused by, like it tries to describe.
It's not just on its own.
Yeah,
okay.
There's like chronic cancer pain.
Gotcha.
But like the general one, I think a lot of people go with is like just chronic overall pain.
Yeah. So the chronic pain just means that it's an ongoing process, and
Okay.
it could be a temporary thing, or it could just be the rest of your life.
Yeah.
And then it could be that there's an issue now, and then later they'll find a cure for it, which would be awesome.
That'd be great.
And then it would still, you would have experienced chronic pain then, and now you're cured, and they'll be.
Yeah.
I mean, and there's interesting ones like Lyme disease, right, where it flares up and it goes away, and it flares up and it goes away,
exactly.
and it never fully goes away. It's not a curable disease, but you can, maintain a healthy lifestyle.
Yeah.
It's called management.
Yeah. You
So
manage it.
the expectation is that you're able to manage your pain eventually through
Right.
whatever different treatments and options, and so that's when you get referred to a pain management doctor, they're not going to cure you, they're just going to make it so you can live your day-to-day life as best you can, which for everybody is different, because some people best they can is, well, I'm only at a 7 out of 10 today instead of my normal 9, and I brushed my teeth on my own.
That's a big one. For some people, though, it is.
Exactly. For some people, it really is a big deal.
It really is. Okay, so an interesting observation, and you guys can tell me what you think. So this specifies invisible chronic illness, and our project is on invisible disabilities. Is there a difference between illness and disability? Is there?
I think that could be a form of disability, maybe.
like the invisible chronic illness is a form of
Yeah,
disability?
I would say.
Yeah.
Do you think illness in general is a form of disability?
Kind of. I mean, I don't know.
If it's chronic.
If it's chronic?
Yeah.
Yeah.
You know, even just like a bad cold can take you out of like.
I mean, it does
doing stuff
disable
for
you
days.
for a couple days.
Yeah.
I mean,
Yeah.
I wouldn't say, oh, I'm disabled for that week, but
Yeah.
like if you
Yeah.
wanted to really dig down, you could maybe
Right.
argue.
Technical. Yeah.
But yeah, when it comes to illnesses, I think of like sickness. You know?
Yeah.
Yeah.
so when I hear
It's
illness-
always the first thing I think of.
Yeah.
Mm-hmm.
Like you catch a cold or freaking get a fever or something like that, you know.
Flu.
Right.
But,
Well, I mean, it's just
Yeah.
interesting because a lot of the things that we're going to be talking about, future podcasts, mental health, PTSD, stuff like that.
Oh
Whoa.
my god.
that was loud.
No, but a lot of the stuff we're going to be
It's a
talking
loudspeaker.
about would be considered an illness, except for special ed. And so,
Yeah.
our first podcast, it would be wrong to consider that an illness in current terms. But it's interesting the connect and disconnect between the two.
So I think an illness is when there's something inside your body that's not functioning correctly. A disability would be like I don't have a leg, not because my body wasn't functioning correctly, but I
That's
had to
just
get
the way
rid of
it
it. So that would be a
So, like-
disability without an illness.
By that definition, couldn't you consider autism to be an illness then? Because the brain is inside of the body.
Right.
Yeah.
That's what's. Okay.
It could be considered an illness, but doesn't it?
I'm not sure. I don't want to say like.
I was
No,
gonna
I
I don't want
wasn't
to say the
I'd
wrong
be-
thing.
No, I was
Like, I
just
mean,
saying
yeah,
it.
I'd be
on that.
curious to look into whether
in actual.
illness, chronic illness, is something that could, in the future, possibly be cured, as to where a disability is more of a permanent gesture,
Maybe, yeah.
right? Where like, if you have irritable bowel syndrome, it's manageable to be normal, and hopefully one day there will be a cure where that's a permanent normal, as to where like a disability, there's no temporary fix.
Right.
There's
Maybe.
not
There
like a
is. You can get prosthetic.
prosthetic, like
Yeah.
that's true.
Like there's.
But you're
certain
still
things
in a
that you
way
can-
disabled because you can't. You're still not
Yeah.
fully back to.
Mhm. But I mean, that could be argued, I guess, for chronic pain and stuff too. Is you're still, even with the Advil, your pain level could be worse than
Mhm.
the person you're sitting next to. Do you think that people's pain, like how they handle pain, is involved at all? So like,
Yeah.
I know that some
Yeah,
people,
sure.
like for me even, I've had times where I'm like, okay, like a family member of mine, I won't name names, she just used to be in bed all the time, and I'm just gonna go to sleep. I'm like, dude, you sleep 20 hours a day. How are you doing it? Just suck it up and get out of bed. But I'm not her, and so is my.
I mean, that could be like it could be comorbid with depression or something.
Mhm.
That could be causing other issues. So,
Right.
And sometimes depression is debilitating.
Can be for sure.
We're gonna talk about that
Yeah,
later
in the
like
future.
I mentioned. So yeah. So I mean, I don't know, cause like for me, so I think my worst days, I probably get up to like a 7. Like I'm not gonna say like I gave birth, and so. Based
Oh.
on other people's experiences and what I've talked to with other people, like I have something to gauge my pain with. I had Pitocin when I gave birth, which is I don't know if you guys know precipitated. Do you know that? So precipitated is when you take something that's supposed to be like this and you squish it into this much time.
Right.
So I had precipitated labor. So
Yeah,
it should have been like 12 and it was like 2. So everyone that I've talked to is like, oh, that's
the
hard.
worst.
So
Yeah.
so I have something to judge my pain on, and like I can confidently say, well, it's probably like a 7 on my worst days, and probably like a 4 on my day to day. So, and I think before having that gauge, I still was pretty accurate. But people who walk around saying that they're in a 10 all the time.
That doesn't. I mean.
If you're
Yeah.
walking around, if you're doing stuff,
Yeah.
you're not at a 10.
Yeah. So yeah.
10 is like debilitating.
Yeah,
Should be.
10 is when you're supposed to be in the ER screaming in agony.
I mean, it'd be weird, like to think like the worst pain you ever experienced, you just always feel that, like, you know what I mean? Like that's kind of weird to think about. Usually, your worst pain is
Terrible.
Well,
it's like a
I
one-time.
was gonna
thing.
say, and it would be interesting to talk to a multitude of people because
Yeah.
everybody's 5
Well,
is
yeah.
probably gonna be way different, right?
For sure.
I mean,
Yeah, exactly.
people that have to, my dad has dialysis and they stick fat needles in him, right? I know, gross, sorry. But that pain to him is no longer like debilitating. But the first time
Yeah.
I can't imagine the anxiety of
Yeah.
having to look at that needle going into your
Probably
arm.
wouldn't
Well, that's a needle anxiety. That's not even pain.
That's
just
well,
like,
yeah, it's just right?
Probably
But-
started to walk away, huh?
I was not involved in that. Yeah, but
Yeah, so when you go to the doctor, they have a little, you know, the
The-
little
the
happy
chart.
face chart, which, okay, you're like,
yeah,
come on.
come on. Who smiles that much? Okay, even when they're not in pain.
So, I mean, you know, there's ways that we can, like, kind of gauge it based on, and then I've seen more accurate ones. Thank you.
No offense.
At Kaiser, they have one that says, I'm in a little bit of pain, I'm in a certain level of pain, but I can ignore it if I'm in an activity that I'm
Mhm.
enjoying. I'm having a lot of pain that's distracting me from, you know, so they have a little better guidelines.
So you'd actually kind of go, oh yeah, that's what I'm feeling. Like, yeah, and you can.
Yeah.
Everyone has the same like.
Do you
Yeah,
think it's
it's-
harder with something that's chronic to measure? So, like, if I get stabbed in the arm, it's pretty easy to tell somebody that I'm at a 9.
Yeah.
But if I have a bruise and it's just constantly there,
And like you just rub it and do it again.
yeah, it hurts,
Yeah.
right? But it's
Yeah.
constantly there, and then you get asked what your pain level is. Well, it's like, well, when I first got the bruise, it was like a 10. Does it still hurt that bad, or have you gotten used to the pain?
Yeah, and it's probably a little bit of both. Or it doesn't hurt the same, but and you've gotten used to it. and
Right.
stuff,
So to like
Yeah.
somebody else, to you on day 1, this is like an 8, but you on day 10. Do you think that has a problem? Like that's an issue with
Yes.
treating
yes.
it?
And my pain psychologist was talking to me about it, and the way that she explained it, I can't remember all 4 parts, but there's 4 parts to pain, and it's the physical symptoms, the emotional symptoms that go with that, the like social
Mhm.
aspect of it, and then I can't remember the 4th one, but there's a lot of ways that pain will affect you, and so just putting a number on just pain itself
Yeah,
is
that's
really
very
ineffective.
encompassing. Like you can't always say like, yeah.
Mhm.
I get that.
Well, and doctors always go like, "Oh, you're feeling better. Let's back off some of the pain medication." It's like, well,
That's
I'm feeling better because I'm on the pain medication,
Mhm.
and I get the idea, right? You don't want to be addicted to pain medication. You don't want that to be your lifestyle, but
Yeah.
it's interesting the way that they try and manage it.
Mhm.
A lot of the results, looking up like just chronic pain, like you'd see like how it leads to, or treatment with opioids, like how it
Mhm.
ends up just kind of spiraling for a lot
Yeah.
of people.
The thing is, like with
Yeah.
like you were saying, you get stabbed in the arm, you take pain medications until the pain's gone, and then you feel normal again.
Mhm.
But if you have pain all the time and it's always at a 6, and then you take
Right.
medication you're at a 3, you're not going back to being at a
Yeah,
6. You
right.
have to now have that medication all the
Right.
time.
It's part of
Yeah.
your. I mean,
Once you,
I'm sure there's studies done that show that that's part of like
Yeah.
coming clean from. You swear that your pain is back. You
Yeah.
know that your pain is back,
Yeah.
but it's not actually.